My wife, Bridget, was pregnant with twins, and for the first trimester, everything was going along well. Beginning of the second trimester, we found out she had a condition called TTTS and needed to treat it surgically.
In October, we were referred to Children's Mercy Hospital. I was a patient at another local hospital. I was pregnant with mono-di twins, and they started to develop a condition called TTTS, twin-to-twin transfusion syndrome. It was a condition that they couldn't treat at that hospital.
With twin-to-twin transfusion syndrome, you have identical twins that share a placenta. So when they're forming their cords that plug into the placenta, some of the vessels from each cord in the placenta hook up. Blood vessels that each kid have bump into each other, and they can share blood. In Bridget's case, her twins were doing that, but they weren't sharing equally. One twin was giving more away than it was getting back.
A few weeks after that, other complications arose, and it became difficult for the doctors to determine if the girls were in the same amniotic sac or if they were in separate sacs. Their cords were, they could no longer trace a difference, and their cords were all together. There was the real risk of them becoming entangled and passing away.
I went into the hospital when I was 25 weeks pregnant.
November the 20th, I took a Christmas tree up there and decorated a room because we're going to be here a while.
I had very low fluid levels, and the twins were at risk for cord entanglement and entrapment.
On Christmas Eve, there was a real complication, and she almost died. She had a placental abruption and was about to bleed out in the hospital room.
We actually had one nurse move us to the room right across from the operating room. I'm very, very grateful that we did that. That saved us several minutes of traveling time to the operating room.
And within 15 minutes, she was in the operating suite with a surgeon, and our girls were being delivered.
And they were able to save my twin's life. And then on top of that, mine.
Sometimes deliveries become complicated, and there's a potential of loss of blood or loss of life. Not to be dramatic, but the end of Bridget's pregnancy had that involved with it, with the premature separation of the placenta and the internal bleeding that was taking place, and then subsequent need for transfusion. It was very similar to what happens in the trauma unit down in the emergency department.
My husband was about to leave to go to his parents' house for Christmas Eve dinner, and I looked down and there was a lot of blood, and a scary amount of blood.
You have to do something, and you have to do it now. You may know what you need to do, but without a huge amount of support staff, you couldn't do anything. You could be the best trauma surgeon in the world, the best obstetrician in the world, but without colleagues, without the nursing staff, without the blood bank, you couldn't do anything. So to me, this becomes the ultimate time of testing the system. And somebody's life's in your hands.
I had just received 12 units of blood after my surgery, so my body was not doing well at all.
The uncommon is a daily event. The remarkable relationship between the two institutions allows for the best minds to sit down and ponder what's in front of you, what's going on here. The very bridge that we're standing in right now is showing the connectiveness with the common focus of taking care of patients. And on both sides, it ends up being the smallest patients you could ever have, which are the ones in the womb.
We're used to higher risk stuff here, so I feel like in stressful situations, we work really well as a team because we do that frequently. Because we send a NICU nurse to all the deliveries, I can speak to the NICU specifically that I work with some of the best nurses I've ever worked with ever. And that starts from the leadership down.
Bridget is a lovely mom, and her two babies, Lillian and Emerson, are super precious. I had the pleasure of taking care of them most of their stay, almost every day that I was here, for months.
I can't think of a better job than a NICU nurse. Our patients are tiny but mighty, and so it's just an honor and a privilege to be able to nurture them as they grow and to be part of that journey with them, with their parents, and to watch them get stronger and to go from a breathing tube to a nasal cannula to now I can eat by mouth and I'm not using my feeding tube, and they're gaining weight and they're doing all these things, and so that's why we do what we do.
The bond that I have with Bridget and with Lillian and Emerson is irreplaceable. I mean, I treat them like they're my own kid, and, you know, like, we genuinely care about each other, and that feeling, you can feel it.
I feel people should support Truman Medical Center because their employees really do care. They really do care there.
If you're looking for a place to put your money to good use, I would highly recommend Truman. The reason that I say that is I've sat on the maternity ward for a couple months listening to the music when all the babies were born. And if you ever wonder how often it happens, you can sit anywhere in that institution because it plays on every floor. You'll hear a little lullaby, and you don't know what that is. What that is a signal all over the hospital that a baby was just born. And most days you'll hear that thing go off 5 to 8 times. Some days more than a dozen times. It's rare that a day goes by that it only goes off 2 or 3 times. And that says it all.